Hey everyone, welcome back to the Chinese Medicine Podcast. On today's episode, I'm going to show you things around the house that you can use that you might just have lying around, like a pen or a paintbrush or a coat hanger, and how you can do acupressure massage on yourself. I got this idea recently because we had a little lockdown where I live. Now, when I say little, we're lucky, it was 5 days. But I had a sore back and I was lucky enough to be able to give myself acupuncture because that's my job. And I did some cupping on my back and things like that. And then I thought about it and I thought, gee, all these people that would have these aches and pains wouldn't be able to come in, and get these things sorted out right now. What could they do at home? And I wanted to make this video then, but, I got busy with doing other things. So I thought I'd make it now because there's people all around the world that are in this situation. And even if you're not, there's times where you don't have time necessarily to go and make an appointment to see a practitioner. And you can alleviate some of the pain and just keep in the flow of things, keep the flow of qi going, let's say. And that can often stop the pain. So where do you find these points? Like exactly how do we do it? So we're going to use the help of this little acupuncture man here to show you some of the points. And I've also got a model back here. And so I thought I would show you on her back to show you where you can find these points, and I'll show you some of them on myself. So let's get started. Awesome. So the first point I want to show you is on your shoulders, and it's called gallbladder 21. And where is that point? It's right at the top of your shoulders here. So how do you find it? So we're going to find this point, gallbladder 21. Now this person's got clothes on, and when you're an experienced practitioner, it's fine. You can do it with the clothes on, but I'm going to take the clothes off so you can see the shoulders and you can see these different parts of the body more easily. And what's great about just using something like this is what it feels like when you don't know what you're feeling. Like it just feels like, I'm not sure what structures I'm feeling. But what you want to feel is the back of the neck. So this is like a tutorial that you can do to do a massage on your partner, or even on yourself. So if you just feel at the back of your neck and you feel where that spine is bulging out, that's usually your C7 vertebrae. Now, it doesn't really matter if it is exactly that or not. For this purpose, it doesn't matter. It's this bulgy part here, and even on this mannequin, they've kind of made one, because that's how if people have a hunchback, they have that kind of hunched up. And then you want what's called the acromion process, which is like basically the bit of the bone that sticks out. Now, if this person had arms, we'd be able to kind of feel like here, like the edge of your shoulder blade, right, the wingy part that kind of sticks up like that. So that's what we're kind of feeling here. Now between the middle of here and here, now how you measure in acupressure is often with Chinese massages, you might use 1 point on this part and 1 point on this part. So I'll show you on her. So just like that, and you use the same fingers and you approximate it like this to go, just want to make sure you can, so 1 point on here and 1 point on here, and you're dividing that in half. So how I would do it, like on me, is like that. Now, on your own self, you can't really divide that in half. You can't get your hands around and do that. I'm not expecting you to do that. What you can feel is like two muscles coming up into like a depression, let's say. That's what we call it in acupressure. So that depression between the two muscles, right here, pretty much on the seam of your shirt, if you're wearing a collared shirt like I am, so something like that. Now, the thing with acupressure to remember is if you press the wrong point, it's not going to do the opposite thing. So I was talking to a patient the other day and I said, you could press a point on your ear. And I said, look, if you don't, for helping with sleep, and I said, if you press the wrong point, it's not going to like make you not sleep. It's not like, oh, it's a button that you press and this does this and this does that. Particularly for treating pain, right? For stopping pain and for alleviating these things. I'll give you a couple of guides to help you not do the wrong thing, let's say, but it's very hard to do the wrong thing. It's very hard to, if you're paying attention to your body, it's very hard to do that. And you're only looking like, you're not trying to do a treatment. You're not going, this video isn't going to make you a massage therapist and you're going to go out and start a business and start treating other people. This is for helping yourself, maybe a partner or a friend or a family member that's stuck in your house with you or something like that. But this is more about treating yourself. So as you're doing that, you're giving yourself instant feedback. You're saying, if this is too hard, well, stop pressing. If it hurts, don't keep going. So a couple of really easy tips to help you give someone a really good massage and make them feel good is to not press on the bone. Bone really hurts. So you could try this on yourself right now. So if you press on your collarbone, that's a bone that you can easily find, kind of just here. If you press hard on that, it hurts a lot compared to pressing on muscle tissue, on things that are not bone, right? if you're pressing around the neck, one of the things that I noticed people do a lot, like this when I was younger, you know, when you were a teenager, you'd get these massage lines and people would be massaging each other through the lines. And there'd always be one person that just wants to kind of almost strangle you, but not intentionally, but they just grab with their hands and they just grab your neck. So if you're compressing an artery, like you have your carotid artery in the neck, that's very dangerous, right? And that would make people possibly pass out, but also just feel uncomfortable and lightheaded. So if at any time you're doing this, you feel uncomfortable or your partner feels uncomfortable, we'll just stop doing it. That's common sense, right? Let's just do that. So what you want to do at this point is you want to kind of find it, and there's a few things you can do now. You can press on it. Now, if you're doing it on somebody else, a thing I would encourage you to do, so let's put her at the front, and you just kind of lean in on that, or you lean with your elbow onto it. So if you're sitting, like you basically lean onto the point. And that's using the flat part of your body, right? So the other thing you can try, so where the coat hanger comes in handy, is to just use that on the point. Now, why I love this coat hanger is because it's bouncy. So I'm going to just do it on my hand. You can hear that reverbing sort of got a bounce. I can feel it bouncing away, right? And what's good about that is it's got a little bit of give, right? It's less likely to cause you pain, like these kind of triangular, this is just a one from IKEA. It's less likely to cause you a problem, painful, than using a stick. Now, so what you can do is you can use these coat hangers to get in on those spots yourself, right? Because we're talking about doing self-massage. And what then you're doing is you're going between the shoulder blade, which is the bony part, and the spine. So your spine's right in the middle and your shoulder blade's just off to the side. So your shoulder blade is obviously bone, it's a bone, and it hurts if you press on it too hard. So if you're using this and you're pressing and it's hurting, if you're got really thick muscular kind of structure, maybe it won't hurt you too much. Muscle tends to hurt a lot less than fat. So if you're overweight and you're pressing on fat, that hurts a lot more than muscle, but bone hurts the most. And you can bruise yourself if you press on bone too much, right? So I'm not into saying press, this isn't very hard, this is very light. I wouldn't press too hard on the neck, like just very lightly, maybe hardly at all, because you don't want to damage or hurt, you don't want to hurt your head or your neck. So this is more for between the shoulder blades, like what muscles wise, we're talking about the rhomboids. So that muscle that goes between your spine and your shoulder blade. And that's the one that you use when you're kind of typing a lot, you're doing this action, right? So you are stretching that out a little bit, but it's when you're hunching and you're on the phone, or you're just kind of hunching up, or on the computer, or looking at devices, you're kind of hunching all this area. So what acupressure is the best for is doing short bursts of it regularly through the day to stop the tension kind of building up to the point where you'd need to go and get a treatment to do it. So what you want to do is keep one of these hanging around. Now, recently I was at my band rehearsal and I started hitting myself with a drumstick, because when I'm not singing the songs, sometimes I play the cowbell. That's my other job. And so someone gave me a little drumstick and I was playing the cowbell in my band. And then I was like, oh, drumsticks are really good, like similar to this, right? Same kind of thing, right? So in this video, I want to share with you things that you might have hanging around the house. So if you don't have a coat hanger like this, you don't have any wooden coat hangers, you could use a drumstick, but you probably don't have one of those hanging around the house. So you might have another kind of stick. You might have something wooden is definitely better than something plastic, because it's got that give and that bounce into it. So these kind of like, this is a very thin paintbrush. Now you could use this very lightly for these kind of things, but it just doesn't feel as good as the drumstick or the coat hanger thing. But this is a technique of what we call tapping or hitting method. You can use your own body as well. And this is called bird pecking method. So what you do is you make your hand like a little peck, bird pecking. And the techniques of acupressure are always the best if you have a loose wrist. So I don't expect people to kind of get this straight away, but this loose wrist kind of action is what's, when you're doing rolling, or when someone's doing any kind of what's tuina, which is Chinese massage, that's how they get feeling good at it, like by keeping your wrist loose. So if I have a stiff wrist, which means I'm not sort of letting my wrist kind of flex up and down, then this will hurt a lot more because there's less give. It's exactly the same as with this thing being bouncy. There's a give in it because your wrist is kind of pecking up and down. So what you're supposed to do with this is actually get a little sound. So I'll do it for you, and it doesn't feel that comfortable to do it over and over, but kind of like this. So you can hear that little tapping kind of sound. If I don't do it hard enough, it's not really getting that sound very well. It's hard for me not to do it properly because I just know how to do it. But that sound, like, you can really hear it kind of like making that sound. That's what you want to sort of aim for. And what you want to do is, when you've done it, like even that time there, if I press on this again, it almost feels bruised in a way. It's not bruised, but it feels tender and sensitive. So that's all you need to do. You don't need to keep going. So what channels would we use on this area? So you want to do the yang channels, which is the outside of your body. So either you could use the stick thing to get on the outside of your shoulders, do your shoulder blades, and the back, right? You can use this to get right down. You can use the drumstick or your wooden spoon or something like that you've got around the house to kind of get right in there. But on your arms, these channels relate to your neck and your shoulders as well. And especially when you're on the computer, right? When you're on the computer, you're sitting a lot, so you're compressing your lower back. We'll talk about that in a minute. But you're also you're just using your hands all the time for different things, and all the tension can kind of cramp up in your hands. So there's a lot of good ways you can kind of release that and stop that from becoming a problem. And one of those things is to do acupressure down the channels. So what we're going to talk about first is which channels you should use. So how are we going to find those? One is, if you, again, feel the bone, you'll feel a little depression sort of here at the front. Again, if you're in the wrong spot, it doesn't really matter. It's not a big deal. But this channel goes, this is your large intestine channel, and it's not, in this situation, it's got nothing to do with your intestine. So it's just a naming system for this method purpose, right? But it's just this is the channel that's going down your forearm. And the main points that you want to use, sometimes people use this point, Hergu, large intestine 4, and then all the way through your forearm at the front here. So if I just kind of bring my forearm here and I do this, you can kind of, I'll trace the channel up here. So the height of this muscle here, right, in this muscular part, that's what you want to do. That's what you want to do. Now you can just use the banging method and go down your arm. So very lightly, much more lightly than what I was doing on my neck, and I'm doing it a lot more heavier on my back, but just very lightly kind of up and down. So any kind of stick, kind of doing that. And what you should feel after doing it is a tingly, like a nice sensation, and your hands should feel a little bit tingly. Why are they feeling tingly? Because you've just stimulated all the blood flow to kind of get to those areas. And that's all you'd need to do. So this hand feels really nice, whereas this hand now feels a little bit tight. So now I'm going to go and do this side as well. So you don't need to do this for very long, just a couple of minutes. And what I used to notice when I was traveling to China quite a lot is Chinese people just know this stuff instinctively, and they call this their Qigong or their Tai Chi, and they either do this when they're doing their exercises, but they will do this as part of their exercise routines. But they also do this at the airport. Like, they've got weird little sticks and things that they're kind of, people are shuffling around, hitting themselves with these things, just instinctively knowing how to do this stuff, because, you know, you're going to get on a plane, you're going to sit there for hours and hours and not move around and have all that stagnation. So these are the kinds of things you can easily do. Now, another thing you might have lying around, you may not, is a Chinese spoon. So we're going to talk about a little thing called gua sha, or spooning, as it's sometimes called, or scraping, and how that fits into this kind of massage. So what you're doing is you're stimulating the channel, right? And some practitioners do this on you when you go in there. You might have seen it done on people before, like a style of Chinese medicine called cupping, which is where we use fire or sometimes use a suction pump to kind of get the air out of a cup and place that on the skin. I'll show you a video while I'm talking about this, of how that works. So what that does is it leaves a bruisey coloured mark on the skin. There's a video that I did with one of my colleagues, Jeff Brothers, and we were talking about what's the difference between cupping and acupuncture and that kind of stuff. So you can check out that video on the channel if you're interested in knowing more about cupping. So cupping's little friend is gua sha, right? Which is the Chinese method of, like, it's kind of also in between self-massage, something you do at home, something practitioners can do. Even I've seen it employed by other practitioners that are not Chinese medicine practitioners. Like, as you know, it's a folklore kind of thing that's been used. So what you would do is, I'll show you with my hand first. So again, with this channel thing, so on the arm. Now, when is this really useful? For people who use their arms a lot for things. So let's say you're typing all day and you've got RSI, or you've got problems with your wrists, like carpal tunnel or something like that. if it's not too inflamed and you're in sort of the in-between stages, or you're under the care of a practitioner, and they've advised you to kind of do this kind of self-massage, well, this is what you would do. And I often advise my patients to do this. Now, you can use your thumb, just the edge of your thumb, the bone. So I'm using like scraping along with the bone. And what I want to show you is how that's already a little bit red on there. Right, so it's getting red where I've rubbed it. And what will happen with the scraping, so I can continue to kind of do it with this, is it'll get red and it'll get to a bruisey coloured mark. Now, I'm not using any oil, but you can use oil if you want to. So here we keep going, keep going, keep going. So you can kind of see that line there where I've been doing it. Now, this is your large intestine channel, okay? So you don't have to go all the way from your thumb, but just in this bulgy part of the muscle here. And we're just kind of doing this. Now, that's enough. You don't need to make it bruisey coloured. You don't need to make it a bruise. What will happen is if I keep going more than this, my arm will actually be sore all day long for the rest of this day. And then tomorrow will probably feel good again. And that can be good if you've got stagnation, you've got knots, and you've got old tissue that you kind of want to release and things like that. But if you do need to rely on your hands to keep doing things, so I've used this a lot for musicians' injuries. I've used it for myself when I first started playing the violin. Well, not when I first started, so I was 4 years old then, but as years went on, I used to have a really bad wrist problem because you're going like this with your violin hand and you're sort of pushing it out all the time. And it just used to be so sore. And actually the thing that fixed it the most was doing doing Chinese massage. It used to be so sore that I couldn't drive my car properly. Like if I had, because this is my gear stick hand, if I had to use a gear stick, it was so inflamed that I would, have it bandaged up. I'd have a wrist strap on it and things like that. And I used to use all kinds of Chinese medicine on it then because I was studying Chinese medicine. And I remember going to China and doing this. I really, really wanted to learn Chinese massage. And I was kind of a bit worried. Like I actually did bring my violin to China that time. So I think I was still committed to playing it. I don't think I played it very much in the hotel where I was. It was kind of, I don't know, I just felt like lonely if I didn't bring any instrument with me for 3 months being in China. But anyway, that's another story. So I wasn't like needing to play it. Like I wasn't committing to playing my violin at that point. Like I was just like, I brought it there for fun. So what I'm getting at is if you do certain other things with your hands and they're already inflamed, you can be scared to think, oh, what if it gets inflamed even more and I won't be able to play my instruments? That's what I would kind of worry about, right? If I do this treatment on it, what if it gets worse? Now, sometimes it does get a bit worse before it gets better. What I found with the Twainer is initially, so with Twainer, you're doing a lot of this movement, like a lot of this rotating. Okay, so you're doing either rolling, you're doing these kinds of things. And I was expecting, because with normal massage, you're putting a lot of pressure this way with your hands. And even if I do that now, it hurts. Like if I push down on this hand, it hurts a lot more than this hand, right? Because this wrist, I guess if I kept on doing that all the time, it would probably flare up again. But I haven't had that RSI problem, like that repetitive strain or that. When I went to a doctor, he just said, tenosynovitis, which is like inflammation of the tendons and the synovial joint. And that's usually what happens before you get to carpal tunnel syndrome, right? So often before that, you'll be diagnosed with tendonitis, like an inflammation of the tendons. So what I'm getting at is I was worried about going to do all this massage because I wasn't sure exactly. I'd never been trained properly in Chinese massage, done a little bit of it before I'd left Australia. But I was doing like 6 weeks intensive of this massage as part of my 3 months in China. And initially it did hurt. My Chinese massage doctor used to tell me, go home and soak your hands in hot water as a treatment to stop the pain that was happening from doing this intense massage, right? Because you're just doing it all day long for 8 hours a day. So what I was saying is that movement is what fixed it, right? Being able to do these rotational movements and having that flexibility in your wrist. And what makes it worse is when you're in a position, so this happens a lot. I see this happen a lot with people who play the guitar or play bass, particularly bass, because you're kind of really having this joint flexed like this, right? Like really flexing it. So getting back to the self-massage, right? So if you've got a serious problem, you've already got a diagnosed condition or something like that, then seek help from your practitioner before you do these techniques, because they might be taking you through a certain kind of treatment where they don't want you to flare it up or they don't want you to do this. But if your practitioner has said to do these kinds of things, then these are the sort of exercises, the self-massage exercises you can do. So what I would suggest you do is, firstly, number one, don't press on bone because it's going to hurt. And you've got more of a chance of bruising your body, especially if you're using something like this. So right in the middle here, that's the gallbladder 21 point. That's the main point you want to use. And then stay on the outside of your body. That's the yang area of your body, not the inside of your body. Now, you're not probably going to hit on your chest with this kind of thing, but the outside, the back of your body, and not the inside of your arm. So even with carpal tunnel, like the problem is with the median nerve, which is, on the medial, like the inside of your body, you would still do the massage on the outside mostly when you're doing that self-massage. The large intestine channel and your gallbladder channel and your Sanjiao channel, they're 3 channels that you want to kind of focus on. So I'll pop a little thing up on the screen so you can kind of see where they are. But when you're looking up these things, because you might go on Google and look up where are these channels, these are the kind of things you want to focus on. Now, when you find an acupressure point, how do you know it's working? How do you know you're on the point? So it should feel like a kind of a tingly, achy, heavy, a numbness feeling, a bloated or distending feeling sometimes. So let's say we use this point here, Hergu, large intestine 4. A lot of people would say, oh, that's painful, right? It's not pain like someone stabbing you, like a sharp stabbing pain. Now, from acupressure, just pressing the points, you're unlikely to kind of generate a stabbing, achy, intolerable pain like you sometimes can get from acupuncture. It's not common, but that can happen. But when you're pressing on the point, it's got to do with how much pressure you put on. So if you're pressing on points on your face, you just have to press very lightly, like you hardly need to press on them at all to get to stimulate the same thing. And sometimes with acupressure, if your body's a little bit more deficient, actually you don't need to press as hard and you can still get that sensation. And you might find that one side of your body is like more sensitive than the other. That's very common. So you might think, oh, when I press this point here, wow, that's really strong and I've hardly pressed it. Whereas this point I'm like pressing and I can't really get that same feeling. So that's acupressure, right? It's the pressing of acupuncture points. That's all it is. So one is you've got to have the right point location. And secondly, you've got to press it with the right amount of force or in the right direction to get that feeling. So what you can do is you can think about your body. So let's say on the shoulder, you're in this little crevice here, in this depression. You just want to press in and sort of press this way a little bit, press that way a little bit, and see which way you kind of can feel, oh, that's a little bit more stronger. And sometimes you can even move your own body towards the point. So if I put my finger here and I move my shoulder towards the point, I'm actually increasing the strength of what I can feel. So another good one is on this point on your neck here, so the gallbladder 20. Now, that would be something you just press with your thumb or your finger. You don't need to use a coat hanger, or stick or anything like that on the back of your neck. So just like this, but if I lean my head into that point, it's much, much more stronger. So that point's between your sternocleidomastoid muscle and your trapezius muscle, so in between the 2 bundles of muscle that are there, and right at the back of your neck. Now, there's actually 3 or 4 acupressure points in that area. So it's not a big deal if you're pressing the wrong spot and you feel like, oh, that still feels good. Well, you're still affecting the area, and sometimes you could have what's called a trigger point, similar to what they would use in dry needling, like a spot. In acupressure, we sometimes call it an AHPRA point, which means like a tightness in the muscle. So that's one technique you can use. You can press the point, you can lean into the pressing, so you're not having to push harder with your body. And you can do that on your partner as well. You can ask your partner to lean into the spot, and that way they're in control of the amount of pressure that you're kind of giving them. If you're giving a massage on your partner, or even a kid or something like that, they generally, kids generally don't need much pressure at all, right? Just a little tiny, and a lot of kids don't like being touched and massaged like adults do. So you might only do a little bit of pressure, and that's enough to kind of release the tightness or the tension that's kind of there. So I hope this video has been useful and helpful to you. And if it has, leave a comment below. Make sure you click the subscribe button. And I'll see you again on the next video soon. I look forward to hearing how acupressure has helped you, maybe in the lockdown or in the just in the times where you couldn't go and see a practitioner, to help sitting at the computer or sitting at a desk. Thank you very much.